Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast, brought to you by Paramena Bliss and ablehealth.us. Today, this is from a request that, while it's not specific to perimenopause, it is something that definitely occurs more during this time, and we're going to be talking about heartburn and acid reflux. So, I use Able Health a lot for this, so if you do go to ablehealth.us, you will find a lot more resources for this by selecting heartburn/acid reflux as a health concern, and it will help guide you through the diet. But let me kind of go through, we really love treating heartburn, GERD, acid reflux, because we feel it's so important to address these concerns using safe, natural treatments. This is because if these concerns are allowed to become long-term conditions, they lead to more serious health conditions. But the problem is that the use of the medications that you're prescribed to treat this, if you're using those long-term, they also lead to long-term health complications, which means that the best option is to use safe, natural treatments, and this will always be in your best interest. So there's a lot to go over. So I think we're going to break it down into the different roles that each treatment can play, and then discuss how you can combine them for fast and long-lasting results. So you can start with one step at a time, but if you pay attention and stay tuned until the end of the podcast, I'm going to go through the combination that I like to use to consistently get fast results. So let's start with diet. When it comes to diet, there's two key concepts you need to consider for treatment. Number one is the obvious one that everyone can find online. So this is avoiding foods that are more irritating and more acidic. So while it's more common knowledge, it's still an important baseline to start with. So this would be an example like coffee, which is a big one. Like, honestly, if this is an issue for you, 1 cup of coffee per day max. Even better, probably just stop coffee. Really spicy foods, tomatoes, citrus, chocolate, acidic foods. And don't worry, you can have chocolate again later in the future. But while we're getting everything healed up, you really need to pull back on these almost completely. Well, I would say pull back on them completely. The more you pull them back, the faster you're going to get results when you incorporate this whole combination. Now, if these initial dietary changes are not enough on their own, then the next dietary step is to also look at possible food sensitivities. So generally, by pulling out certain foods from 1 to 4 weeks, and the most common food sensitivities that we've noticed when it comes to heartburn and acid reflux, it's almost always the same top ones that are always problematic, which is dairy, wheat, soy, corn, eggs, and sugar. So one more time, that's dairy, wheat, soy, corn, eggs, and sugar. If it comes down to it, you're not seeing the results just from pulling out the acidic foods we mentioned previously, you pull these out at the same time while you're getting the gut and the intestinal tract to heal. The next thing we want to address is what can we use for supplements to help with the excess acid, or sometimes that's maybe not the best term, the improper use or like the positioning of the stomach and the acid. Let's get to that later. But rather than using these medications that just block your stomach acid and therefore block, a part of your immune system, block the first stage of digestion, we just want to help kind of coat the stomach, reduce the inflammation, and therefore reduce the effect of the acid. So we use a product called Entero Effects, and while I don't want it to seem like we're only promoting our own product here, I'll give you a breakdown of some of the things that we use in it. Special types of licorice extract are in it. Slippery elm is built in it. Different forms of zinc are an important thing, and then there's an herb called meadowsweet. This is key. Meadowsweet is very, very underutilized, I find, by most people for this, but it's extremely important for that. And we use it in the tea form too, which we're going to discuss very soon. So we want to do that, something that's going to coat the stomach. This is almost like a powder, and you mix it with water, it forms a gel, and it just coats your stomach. And the best time to take that is at night before bed, so that the stomach's coated and it's preventing excess acid from coming up into the esophagus. Because that chronic acid coming up into the esophagus causing irritation can lead to major esophageal problems, which is what you really want to avoid. The second thing that you want to consider is the bitters / antimicrobial combo. Really, we just call them bitters, but know that the herbs we use in the bitters formula also have an antimicrobial effect. So if the stomach symptoms are consistently accompanied by bloating as well, or if the symptoms started after traveling or food poisoning, this formula is very highly indicated. So the way this works is that you take the bitters formula with meals. It will do a few different things. It's going to stimulate your digestive enzymes to produce more enzymes so that you're digesting your food better. By digesting your food better, it will help prevent the food from just sitting there in your stomach and then the acid from coming back up. So in all honesty, sometimes it can actually make you produce more acid, but yet it prevents heartburn. It sounds counterintuitive, but it consistently works. The bitters formula with these antimicrobial herbs, one of the common things that you will see with heartburn, sometimes it can be H. pylori, sometimes they'll use the terms like SIBO, but basically there's a bacterial imbalance. These herbs will help kill off any of the bad bacteria, and then as you have a healthy diet, you can reestablish the good bacteria. So the bitters is key. Herbal teas play a very extremely beneficial role, also for soothing the stomach, and typically you would be using this after meals. So we use a digestion enhanced blend, but again, the herbs in it, just so if you wanted to look these up, meadowsweet is, again, we already talked about previously, anise, licorice extract. Those would be the top three by far. So meadowsweet, anise, and licorice, and those can help reduce excess acid and reduce inflammation in the stomach. Okay, here's the one that never gets addressed, but you have to address. So acupuncture plays a role, but physical therapy even more so. The vast majority of cases that I've worked on for GERD and heartburn, it's very common for the stomach to be slightly elevated out of its ideal position, which would be called like a very mild hiatus hernia. This seems to have an effect that the sphincter at the top of the stomach, if it gets pushed up through, it's like it blocks it from closing properly, so the acid is constantly moving up the esophagus. So if you're getting, even after small meals and you lie down and you always feel this acid coming up the moment you lie down, sometimes if it's really bad, people almost feel this like where your stomach is or just kind of at the base of your lungs, they almost feel like it's difficult to get a full breath because it's literally pushed. That would be a more severe case. But most of the cases are mild enough that if you're getting a scope done or anything like that, it's often missed. But yet when you do the stomach adjustment, it helps consistently. Sometimes after one adjustment, most commonly after about 3 to 4 adjustments. So what causes the stomach to come out of position in the first place? Sometimes really bad coughing, vomiting, pregnancy, being overweight, basically anything that increases the abdominal pressure in your stomach and then can therefore push the stomach upwards. And I can't stress this enough. This is very, very common, and its correction is like one of the key foundations of the treatment. So to correct this, we're going to be putting a video on Able Health to better show how to correct it. I'll try and explain it real quick. But basically you would lay flat on your back with your knees bent. You locate your rib cage, and then you follow your rib cage up to the midline of your body. So you start with your hands right on the midline of your body, just underneath, like I said, under your rib cage. You take a deep breath in, and as you exhale, don't force the air out, just exhale and let the air out. And as you're letting the air out, you're pushing down into your stomach, and then as the air is all the way out, then you're pulling your stomach, pulling this area down towards your belly button. So just like you want to push in and then pull down to your belly button, all as your exhale. Again, we're going to put a video up showing showing exactly how to do it. But if you're unable to do that, you should be able to find a chiropractor or a massage therapist or an osteopath who knows how to do this technique. And it's simple. We're talking, it takes 5 seconds to do it. So if you can do this on your own, though, you would want to repeat this. So when you're lying down in bed before you get up in the morning, you do this little adjustment. When you lie down at night, especially to prevent the acid from coming back up, you do this little adjustment. So you just do it in bed when you're laying down and relaxed. In terms of testing, if you have really chronic heartburn and it's really severe, you want to probably get tested for something called H. pylori, and a lab can do this with just a simple breath test. So while it's not as common, when it does happen, this particular bacteria can lead to heartburn and ulcers, and you want to probably check it and rule out. But again, it's not as common. One last thing too with regards to this, medications. There's a lot of medications that can cause irritation of your stomach. A lot of anti-anxiety medications, and especially a lot of painkillers. So if you're taking lots of painkillers for headaches or joint pain, ask your pharmacist if any of those can cause acid reflux or ulceration or GERD or any of those things. Because sometimes you'll know right off the bat because they won't even give you that medication unless they're also giving you what's called a proton pump inhibitor because that blocks your stomach acid. So that's the same medications we are warning you about at the start. Okay, so let's kind of review, and here's just a basic strategy. I wanted to talk about this basic combination that you can use to just build it in so it becomes an easy part of your routine so you can get fast results. Number 1, some slight dietary adjustments that we spoke about, cutting out the acidic foods and pulling back on coffee. With your meal, you take this bitters formula, and it's generally about a half teaspoon in an ounce or so of water. And then after your meal, you drink some of this tea. When you lie down at night, you do this stomach adjustment. Before you get out of bed in the morning, you do this simple stomach adjustment. And then if you're on any medications, talk to your pharmacist about it and ask. It's as simple as that. And if you're not seeing results with that, then again, tune in to the ablehealth.us, and we have better descriptions in terms of how to do that adjustment for yourself. So I hope this was helpful. This is something I treat extremely often, and it has very good results when you use this combination. So I hope you can use this and get the benefits that you're looking for. So this is Doc Yates, and I am signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.